Hello, and welcome to the Holistic Nurse Academy podcast. I'm Holly Taylor, a board certified holistic nurse and a registered nurse of 15 years. I am here today with Jennifer Anderson, also a registered nurse and a nurse coach, board certified nurse coach, and a functional practitioner, right? How do you say
Functional
that?
nurse coach is what I call myself.
Functional nurse coach. Okay. So we're just going to talk about, what we were just chatting about before we started recording was that we're here as nurses to share in stories, share in the journey, but also give other nurses who are kind of searching for their next thing or what else they can do with their license, some guidance. And I think we all have a really interesting story along that path. What gets us here, what leads us to this moment. But I know for me, Jennifer, and we'll dive into your information and story soon. It was a journey and it wasn't a clear cut path. And I had to do a lot of breaking through the weeds and the forest, so to speak, because it didn't feel like charted territory.
Mhm.
And I'm hoping to decrease the resistance for others who are searching for what they can do with their nursing license outside of bedside nursing or hospital nursing or the really hard, grueling stuff, which this is not easy. It's not for the faint of heart either. Entrepreneurship and being self-employed has its own obstacles. But I did read on your bio some interesting things about you and how you became more interested in this type of nursing. What Before we go into that part, what drew you to nursing initially?
That's a great question. I say that I was functional and holistic before I became a nurse.
Okay.
So in the early days, back in the old days, I'm a mature girl. I taught school for a short time, and then when I decided to start my family, I was fortunate enough to be able to stay home for several years. And so just changing economy, things needing to get back to work, the crash in 2008 really changed economics for our family.
Mhm.
And I had just in the process of having my family, I'm a big researcher. So I really learned a lot about childbirth, and I actually went through doula training and training as a childbirth educator.
Okay.
And so really I went to school. So 2008, after you were kind of scrambling, like, what's next? I'm like, okay, I need to recession proof myself. And I just stopped and I thought, if I could be anything in the world, like if money were no issue, what is like the coolest job, the most fulfilling thing that I could do? And so I decided I want to be a midwife. So I'm like, okay, I'm just going to do that. I'm just going to start that in motion. And um, we had some financial setbacks, and so I'm also thinking about how do I recession proof myself. And so nursing is a second degree for me. I'm close to 40 at this time. And so I thought nursing sounds great. I looked at all different kinds of things. And to me, nursing, what really drew me in is there were so many options. Like I could work in the
Yeah.
hospital, I could work in a physician's office. I've always had kind of that entrepreneurial spirit. And I thought I could have my own business. There's really no limit to what I could do as a nurse. So that's what drew me in. And I went in
Hmm.
with the intention of going to midwifery school and life and that didn't happen, and here I am, and so but everything unfolds the way it's supposed to,
It
right?
does. It
So
absolutely does. So, what type of nursing did you do prior to what you're doing now?
okay, I started out in cardiac med-surg in the hospital for several years, and then in 2015 I moved my parents in with me.
Uh-huh.
They were needing care, and so fortunately, we were able to accommodate them in our home. We did some remodeling, and so I was still working at the hospital, but then my mom started to decline and needed more consistent care. And so I left the hospital, and then I went to working remote and did transitional care and chronic care management. So this is, I'm calling the patients once they leave the hospital, making sure they have their appointment to come back in 7 days if they've got, if they're heart failure or whatever. And so that was really interesting. And on the chronic care side, I'm calling patients once a month. So this is before I have any of my coach training, but essentially I'm coaching and I'm educating. And
Right.
I really enjoyed that because it was very flexible. It allowed me to be home with my parents and provide care for them. And then again, when my mom declined and needed to go on hospice, I left that just to become a full-time caregiver.
Yeah.
And then during COVID, I went to still have my dad. He's in his early 90s at this time. And I tried to position myself to be as low risk as I could, like meaning I need as little exposure. I have to work, but I need as little exposure as possible.
Yeah.
And so I decided, so I went into hospice at that time. So 2020, I'm going into hospice. And I figured, I'm only going into a few home. I'm just exposed to the, those 5 or 6 patients, 5, 6, 7 patients I'm seeing every day, families. I figure, I'm trying to keep my dad safe. So at the end of towards the end of 2021, we got COVID in our house. Actually, I got it working, and he ended up passing very quickly. So that was, you can imagine I'm feeling a little traumatized.
Yeah.
So,
Yeah.
so
Very.
by 2022, I'm just really, really burned out. So, I've lost my mom, I've lost my dad now, and they lived with me. So it was very life changing. It was very life altering because they were, part of our everyday life. And then so 2022, I was like really struggling, and I'm, in the throes of perimenopause and not really, I didn't know then what I know now about treating perimenopause and how to deal with that. So health-wise, I've been going through a lot of stress the last few years. I'm burned out from nursing. I'm, really burnt out. And then, so I decided in 2022, I'm like, I've got to get out of traditional healthcare because I came in with that holistic mindset just years before dealing with my own health issues. I knew about root cause medicine. And so being in that traditional environment was very difficult for me. So, so 2022, I've decided, okay, I'm going to do this. I had always wanted to go to the Institute for Functional Medicine because I'd followed them for years. I'm like, well, that program seems like it's for physicians. So really wasn't for me, but I had always followed them and followed their education. And then I found that the Integrative Nurse Coach Academy had a program that was aligned with IFM, the way they teach, and it was for nurses. So I was like, awesome, I'm gonna start here. So I started with the functional medicine course, loved it. The week that I started, though, unfortunately, I had a brother that passed away. So that added to, and that was all very traumatic. That's a whole story in and of itself. So I've lost 3 family members in 3 years, and I'm just like, after losing my brother, and I was still working in hospice at this time, I was okay going back after my mom and after my dad, but after losing my brother, it was just too hard around the dying. And I love that. And, I was a doula, I worked in hospice. There's so many parallels there. I think that's,
100%.
space when we're bringing new life in and when we're ushering life out. I think that's such a special time. It's a great time to do education and to just be with families. And so I love that aspect. But it was just really hard to be around the dying. I just couldn't do it anymore. And so mid 2023, I decided it's time to step away, and I'm finishing up my functional nurse training, and I'm getting into nurse coaching now. So I finished that the rest of 2023 and started focusing on that. Um, so that just kind of it took me a little bit to get through that and to get my certification and to get myself together. So early 2025, so last year, I actually started my business. I'm
Okay.
continuing to do education. I've done some other trainings in functional medicine. Right now, I'm training with the Institute for Functional Nursing, which is also very aligned with IFM and their standards. And
Yeah.
it's a great course. I'm learning a lot. It's very in depth, and so now I work one-on-one. I have a very small practice. It's all virtual, and I help perimenopausal and menopausal women who are dealing with chronic symptoms, autoimmune symptoms. So that can show up as a lot of
Right.
different things. Hormone chaos, like all of that, is so intimately connected. And so I love helping women kind of sort those pieces out and regain their health.
That's awesome. Well, what a time to be in perimenopause and menopause care, huh? We
Oh
have
my
lots to
gosh.
talk about. We have
we,
lots to talk
we
about
could chat
there.
for days about that.
Yes. So we're
I
going
have
to
a lot
come
of
back to
thoughts.
that. Yeah,
Yeah.
let's talk about that because I know this is yeah, myself. I'm in the perimenopause
Mhm.
age group. So but before we get into that, I want to talk about if there was, even though you knew it was time and this wasn't working for you and your lifestyle anymore, I'm just curious because this happened for me. It took a while for me to unwind this a bit, even though I knew I wanted to do what I'm doing now. Um, did it feel like I don't know, scary is the right word. What were the feelings about leaving traditional nursing? Was it a very easy decision, or was there an internal struggle with, you know, I've worked so hard, or this is the way we're taught to do it, and then what will people think? Or was there any of that inner struggle?
I can't say that there was. It was pretty easy for me.
Okay.
Again, I came in very holistically minded. I'm thinking I'm
Yeah.
going to be a midwife. I was, um, so
Did
even
you
during
always feel
nursing.
like a fish out of water?
Oh, always,
Yeah.
always. And, I knew a little bit about, so when I worked in the hospital as a newbie nurse, I knew I had gone through healing my gut and healing my autoimmune
Mm.
or getting
Hmm.
under control. I can't say heal, but
Yeah.
really managing that. And so I knew about gut health. And so I would try to talk to my patients and I would try to talk to the GI doctors and they would look at me like I had three heads, like I was some crazy woman, if we want to make the gut healthy. Nobody understood that. Nobody, and I think
Hmm.
now it's more talked about,
Hmm.
but this is 2013. People are still, we didn't have Instagram.
Right.
So, right? So there's a lot that we didn't know. So I always felt out of place and I was always trying to bring a holistic aspect into my nursing. And that was before I had found like the Holistic Nurses
Yeah.
Association, and it didn't take me
Yeah.
long to find them,
Yeah.
but and then I started training in other modalities, and but yeah, and that's one thing that I loved about working in hospice is it did allow me to
Yeah.
have a lot of leeway to bring in holistic care.
Yeah.
So, I'm trained in aromatherapy and I'm trained in healing touch, and so if it was appropriate and I had clients that were open to that, I would offer that and feel like I can do that. That's well within my scope as a nurse.
Yeah.
And so people love that. I think of one patient that I had. He had severe heart failure. He was a veteran, had sustained a lot of injuries in the military during his military service. And he had been going to an acupuncturist weekly for pain management. And so because he was on hospice, he couldn't get he physically couldn't get out of the house. And so, and we were dealing with a lot of chronic pain. Of course, he had pain medication, but it wasn't all that he needed. And so I offered
Yeah.
him healing touch. And so I would do some work on him and then it would, without fail, by the time I would be done, he'd be asleep and his wife would be like, I can't believe this. And he'd be out of pain. We actually discharged him. He's one of the very few patients that got better. He was very sick. He said, I don't want to die. I want to get better. So I'm like, okay, I'll pull out all the tools. Not that it was me, but like
Yeah.
supported him in that because that was what
Sure.
he wanted. So
I
yeah.
love that. I love that so much. Well, I something I want to talk about today is this theme I've been seeing um on the internet. So,
Mhm.
social media or whatever, since we're on this topic. Um, well-known physicians in terms of social media, where I actually follow them because I like them and I like the data that they give. I like that they're scientifically based. That they have a really good way of articulating, hard, complex things to educate on.
Mhm.
But what I've noticed is a theme of where they take kind of what you're talking about, these other modalities where that people are demonstrating, like in their own reels, like muscle testing or different alternative cam modalities,
Mhm.
and they're actually making fun of people for doing them. And they debunk them and they say how ridiculous they are and um, how they can't support them. And I'm heartbroken a bit because um, I like these particular people as a general rule. And I also feel like this is not helping where you found yourself, for instance, all those years ago, where the system lets you down,
Mhm.
or the system isn't the answer for you. And when I say the system, I'm talking about the go to your doctor,
Yeah. Yeah.
talk about the thing, get a diagnosis, get a prescription, and sometimes that formula works great.
Mhm.
And but there's so many people right now where that formula has um, disappointed them, has let them down, and then they lose trust because then there's this, well, I don't know what to do for you. And instead of saying, maybe there is something to these things, they're making fun of them. Meanwhile, the system is letting them down, their patients down.
Mhm.
So what's the answer, And I just wanted to kind of have a dialogue about that and what your thoughts are
Yeah.
because I had mixed feelings about what they were doing by putting somebody on blast for showing a different way. And they just call it, it's just pseudoscience and it's not
Right.
real. And, um, well, you and I have tried other of these complementary alternative modalities and actually have had some success with them personally. And we know people who have had success. So what are we making of this? Other than there is now more science to back it up, there is data to back it up. But tell me what your thoughts are.
Right. Yeah, that disappoints me too when I see it because I was like, "Oh, I really like what you say, but you missed the mark on this." And I
Mm-hmm.
think it is just that's not their area of expertise. They just don't have training in that area. So,
Yeah.
I think the problem there lies in our medical system is based on an acute care model. So when you come in, no matter what it is, whether it's chronic, and most things are chronic, right? 80%
Yeah.
of what we spend and treat is chronic, but yet we apply an acute care model. So if you have hypertension, if you have heart failure, there's a checklist of what we need to do for you. Of you're going to be on this class of drug, then we go to this, and there's a script, and physicians have to stay in that script. Well, somebody coming in with hypertension, let's say you have a 50-year-old male coming in with hypertension and you have a 50-year-old female coming in with hypertension. Those are two very different things, very different
Mm-hmm.
things are going on. And so rather than we treat the disease, so a functional, I think what we need to do is look at root cause. What's behind that? Because there are
Yeah.
100 different things that could be causing her hypertension. We know that women, as they approach menopause, that estrogen kind of tanks, and we know that that is pro-inflammatory. That's a contributor. We know that as bone loss happens, that women can release toxins from the bones that have been stored there for decades, and that can cause hypertension. So there can be a lot going on. Rather than treating everybody the same, let's look at,
Yeah.
okay, what's your story? What's going
Right.
on? What's behind this hypertension? So we're not treating people, we're treating hypertension, and we're giving everybody's got to fit into these nice little boxes. And it doesn't really work. I think it works great in acute settings. That acute care model works great in acute settings. So if somebody comes
Yeah.
in with a heart attack and, we've got to take them to the cath lab, man, I'm glad that cath lab exists. I'm glad
Right.
that we've got trauma care. So I'm not trashing our system. And there are so
No.
many good people that work in healthcare. And so, if I'm
Agreed.
in a tragic accident or I have a horrible diagnosis, I hope those people are there and I hope I get the best of care.
Right.
However,
100%.
if we look at what we're treating, most of these people are in there for chronic conditions. And we know that lifestyle is the
Huge.
contributing. I mean,
Yeah.
lifestyle is everything. And
Yeah.
so, as a hospice nurse, it's so frustrating. I'm seeing all these, I took care of a lot of end stage Alzheimer's patients. And so it's like, oh, we know what causes this. We know her thyroid's been out of whack. She's been on a PPI. She's been on cholesterol lowering medication. We know those things can contribute to Alzheimer's.
Yeah.
So, I think we just need to be looking at a whole person model. I think that's the
Yeah.
answer. Just, everything we do in our current healthcare system is acute based, but not everything is acute.
Yeah.
So,
I love that. That
yeah.
is a wonderful answer to that question. Because I'm like you, I embrace it all. I want to embrace it all. I want there to be room for it all.
Mhm.
My intention is to bridge the gap, for instance, between Eastern and Western medicine, even though some of these CAM modalities aren't necessarily considered Eastern.
Mhm.
Um, that's my goal, is that we can hold space for both things. And so, I didn't name names because I don't want to throw anyone under the bus, but I do want to say, like, we can do better than
Well,
just completely dismiss something outright because it looks ridiculous. For someone, it met a need. And for someone, it's meeting that need that, frankly, the Western system is letting down right now.
mhm.
So who are
Yeah.
we to say, who are we to say you can't do that and you shouldn't do that if it is meeting a need? Um, so
Right.
we had talked about last time with my guests that there is more research being done, which I'm so grateful on CAM modalities. And because I love the research, I love that we do research, but sometimes what's happening in real time hasn't been researched and yet it's still effective. So we have to look at the why.
Yeah.
Um,
Yeah.
but so yes, I
Some,
appreciate your answer. Go ahead.
yeah, with research, I think the latest number that I've heard is it takes 17 years for like in our
Mm,
healthcare system, like for research to get into practice. So, and I
yes,
remember as a
takes
new
a very
nurse, I
long
remember
time.
going to nursing school and, when we wrote papers and did things, it had to be within research within the last 5 years. And I'm sitting in my orientation at the hospital and they're pulling up research that was 20 and 25 years old. And I'm like, what?
Right,
We're
right,
using research from 20 years ago? Like,
right.
what is this craziness? And
Well,
so it just
let's
so
see.
there's a big lag. That's something else that we need to deal with is the lag
The
between the
lag.
research and putting that evidence into practice.
Totally. Well, as you're saying this, I'm thinking of Dr. Mary Claire
Hmm.
Haver. Do you know her?
Hmm. Yeah.
I would imagine you do. She's in
Yeah.
your wheelhouse.
Yeah, she is.
I think she just posted something today where, she talks about how when she started, says like, I don't know, 35 years ago, when she was starting her OBGYN, clinicals and becoming certified, how vastly different things were. And now there's been all this research, but it's taken this long for it
Hmm.
to hit the pavement, so to speak. Um, she said, I know that better than most because I got menopause wrong for years. Board certified and wrong. The WHI was misread in 2002, and it took nearly 2 decades to correct. So she's talking about the science behind
Hmm.
things. And then she said, and that correction came from scientists reanalyzing the data. It did not come from a podium. That is the difference. A recommendation that changes because of new evidence is the scientific method working. A recommendation that changes because of, she's talking about politics is something else. And calling it gold standard does not make it evidence, which I wholeheartedly agree with.
I agree with that.
But she's even saying, we got it wrong for a bit and now we're correcting that. So I love the ownership on that. I love the ownership and then their course correcting. So that leads right into your understanding of your own symptoms and turning that into what you help people with in perimenopause and menopause. What are your discoveries? What are you noticing? What's standing out to you right now?
I think the biggest thing is still the lack of research, because we put it aside. So that study they started, I think, in 1991, the WHI. And they, by 2003, we took everybody off hormone replacement. So I'm meeting women now in their 70s and 80s who have had no hormone replacement, who have had hysterectomies with ovaries removed. And the reason that their doctor gave for removal of ovaries is because then you're less likely to get ovarian cancer. Well, that's true. If something's not there, it's not going to become cancerous, right? So all of these women have been essentially castrated.
Yeah.
And we know that, every cell in our body needs that estrogen that those ovaries produce. And their health has just tanked since then. And my mom was one of those women. So I watched her during her lifespan. I never remember her being healthy. And I attribute it, knowing what I know now, it's that hysterectomy that she didn't need. And the doctor said, well, you're done with this. You have too many kids. Let's just take it all out. And that really started the cascade that really made her health decline and made the last 3 decades of her life terrible, really.
Yeah.
So I think that's criminal, because we would never say, well, we're going to remove your testicles so you don't get testicular cancer. That is never
Right.
happened, right? Like,
No.
we don't do that, but that's what we're doing to women, and that's what we've done to women. And I think it's criminal. I mean, I really do. I think that kind of care is really criminal.
Yeah. It's heartbreaking.
It is.
Yeah. It's heartbreaking.
And even now myself, for the last several years, and I'm celebrating this week. I'm officially menopausal this week. It's been a year. So but I say that, like, okay, ladies, we need to know what's going on and where to go for help. And even, a lot of the training I've done is to solve my own issues, right? And even finding providers today that really understand how hormones work. Most of them out there are just writing prescriptions, and they don't know what they're doing. They don't know. No. There are no standards for monitoring, for one. We only know that, with estrogen, we know that a level of about 70, is it 60 or 60, I think, is protective of bone. But beyond that, there's no studies of what does estrogen do for our brain? What does it do for our heart? What does it do? There are people that saying, let's push it higher for that brain and heart protection. Studies aren't there yet, or they're just, we're just starting to think about studying that. I'm like, it's crazy. It's 2026, and we're finally paying attention to the needs of women in their last 3 to 4 decades of their life. Like, what is this?
I'm shooketh. Like, in some way, I didn't know that we weren't talking about it until we started talking about it. And I was like, oh my gosh, we have not been talking about this.
Right.
What the heck? And so in a lot of ways, I'm grateful to have the knowledge now. But you're right. There's a whole generation of women who were totally neglected, and, a lot of damage was done. And, one of the things I've heard, I don't know if you've heard this, and I think it was from Dr. Mary Claire Haver, is that going through the change, and I think estrogen in particular increases your risk for urinary tract infections. I don't know if you've heard that or not, but when I heard that, as somebody who's worked with the geriatric population for 15 plus, 20 plus years, I was like, that could be game changing.
You mean
Um,
it decreases UTI? Like you're
oh,
talking about vaginal estrogen decreasing,
not you're not
or
having
not
estrogen
having estrogen?
increases
Yes,
your risk
yes.
for urinary tract
I saw
infections.
that a lot. Women who become
Yeah.
septic because, and if we just give them vaginal estrogen.
I'm just like,
Here's,
put everybody on it because,
right.
like, I mean, that was my first instinct because I saw, falls were so, just like as a hospice nurse, you saw
Mhm.
this, I saw
Right.
this in an assisted living. The number of fall reports I was filling out on a daily basis, and I was like, and then the number of UTIs that I saw,
Mhm.
and I'm just like, and we have no answer. And now I'm like, the light bulb has gone off,
Yeah.
truly.
Here's my beef with that though. I have a big
Okay.
beef with with vaginal estrogen.
Oh, tell me,
I'm,
tell
I
me.
so as a mature girl, I'm like I want to do all the things. So I got my prescription and I'm like I read it and it is full of toxic ingredients.
Oh,
This is
really?
this is through the pharmacy. This is so if
Okay.
you're trying to avoid sulfates, if there are ingredients that you know are known cancer causing chemicals and hormone disruptors, they
Mm-hmm.
probably should not be in something that we're putting, in our
In
vagina.
our vagina.
Right? I mean, call me crazy. So I'm like, I
Yeah.
cannot use this. Like, I can't, like, I don't use stuff
Oh,
anymore with these ingredients. So if anybody yes, the estrogen is protective, but I think we really need to look at, okay, what we're giving women is also full of toxic ingredients.
right.
So my solution has been, I'm using a compounded version and I've looked
Okay.
at compared different bases. So I'm using something from a compounding pharmacy. I think the base is called VersaPro. There's different bases out there. It's not the cleanest thing out there. I think the cleanest thing they can put it with like a jojoba oil or olive oil or something, but then
Uh-huh.
we don't know how well that absorbs.
Okay.
Although, I mean, I know that jojoba oil typically is one of the best carrier oils because um, it's very highly absorbable by the skin. So
Mm-hmm.
I know that from my aromatherapy training, but so I think that may be okay. But my solution, my workaround has been like I can't use pharmaceutical vaginal estrogen. I've got to use the compounded. So, and
Okay.
fortunately, I can do that. But what about the women who can't or don't have
Who
access to
can't?
that? You know,
Right.
do we really have to make it this toxic? I
Right.
mean,
Yeah.
and I've talked to doctors, I've talked to pharmacists, and they're like, yeah, they're all the same. They're all, so
That's
that's one
wild.
of my big beefs. I thought I could just like make a career out of talking about that. Like, just like,
There you
really,
go.
this is the solution. Okay, we're going to give you your estrogen, but here it's full of toxic
Here,
garbage,
have
you
some
know,
cancer, yeah,
like,
inducing estrogen. My
yeah.
heck.
So,
That's
and there
wild.
are other solutions, but yeah. So there's, the good thing is there are a lot of options out there
Yeah.
for hormone replacement therapy. This is both pharmaceutical and compounded. So that is the good thing. The good news is there's a lot of evidence, there's a lot of
Well,
resources out there. But the downside is you've got to hunt quite a bit for somebody
yeah.
that knows what they're doing and how to monitor that. And also, one of my other beefs is we're just throwing hormone replacement at women, and maybe they have poor liver function or their detox pathways aren't really working properly. So it's actually like their symptoms are worse. They're like, I feel terrible on this. Well, that's because you've got some other foundational work that you need to do. So that's kind of where I
Yeah.
come in and help
Yeah.
with
You're
that.
looking at, again, root cause and big picture. You're like looking at the
Mhm.
whole
Yeah.
thing, which, is a wonderful way to do it. But I want to talk about how you help people and like how your assessment goes and
Okay.
just kind of walk us through the process. But before we do that, what are the other, let's talk about the options and the other options in compounding pharmacies and, you know, let's talk about any of that you can educate us on. in terms of that?
Well, as far as estrogen, the patches are really popular. They work for a lot of women. I'm meeting some women that just don't absorb that well. I'm still learning. I can't say that I'm an expert at
Sure.
this yet. I'm still learning.
Yeah.
But for some women, those are FDA approved. You can get them through your pharmacy. You're covered by insurance. So that's a good option. They're saying that if you have a uterus, that oral estrogen is not, that you have a higher clotting risk because it's got to go through the liver before it's absorbed. So there's a higher clotting risk for oral estrogen if you still have your uterus. There are creams, compounded creams that you can get through compounding pharmacies, but then you have to look at, is this a legitimate pharmacy, and what other ingredients are there in there? So,
Yeah.
but they're
Well,
out there. Um,
let me say
yeah,
this real quick
yeah,
because you brought up a good point. This is for educational purposes only. This is not medical advice,
right.
right?
Yes, yes.
Uh, I'll just quickly insert that. But to that point, I've been kind of on my own perimenopause journey. And, kind of to your point, is it's hard to find someone who is an expert because this is something that needs more experts.
Hmm.
This is something that we're all learning in real time. And there happens to be a handful of people who are ahead of the curve, like yourself and some of the doctors I'm seeing. But even, I've had to do some digging and research to find someone who at least can speak somewhat the language, who I still don't feel like is the expert, but at least can go there somewhat with me and is willing to talk compound pharmacy and all that, which I've had to discover on my own too. So I just think it's all very new,
Hmm.
even, for medical professionals, we're
It
learning
is.
in real
Yeah,
time.
yeah.
So I don't think it's fair to have too high of expectations, but like it's good that you are ahead of me so that you can teach me, you know what I mean?
Yeah. So, yeah, and there are other options. There are injectables. I don't know too much about those. And then there are also pellets, which I have not heard great things about. Again, I'm not the expert, but the issue with pellets is you have this dose and it's going to be, if it's not working for you,
Yeah.
there's nothing you can do about it for several months.
Yeah.
So I
Well,
would,
and I will say with the pellets and their testosterone, they're a organic testosterone replacement, right? Is that how you would?
well, you could do it for anything, I think. I mean, testosterone,
Yeah.
estrogen, I think yeah.
Yeah.
So,
But the other thing is it's a pretty invasive procedure in my
mhm.
opinion, in the sense that you
Yeah,
have to like open up the skin and they have to insert it underneath
yeah,
uh the
yeah,
skin.
yeah.
I think that's pretty invasive in my
Yeah,
humble opinion.
I agree. That is not someplace I want to go, but
They have to
but
do a sterile procedure.
yeah, yeah.
Yeah.
Um, to each their
Okay.
own. I mean, some people do
Yes.
love that because
Yes.
it's like, oh, I only
Right.
have to, I know what my levels need to be. I'm at this level. So again, find a reputable physician, not your pop-up med spa that, we're doing
Yes.
IVs, we're doing hormones, we're doing, GLP-1s with no oversight. And
Yeah.
that's not a slam against GLP-1s. I think they're a great tool, but again, we've got to have help with that. So,
Yeah. I mean, we could have a whole episode on med spas and just kind of what to look for because I have the same feeling as a nurse. I have a gut reaction when I walk into a clinic that is a hormone clinic, GLP-1 clinic, and then they're injecting fillers and Botox. Like something about that doesn't work for me at all. So, I think they should be separate in my humble opinion,
yeah,
because they're very different needs. But um, you see a lot of those popping up, and you can end up with some pretty sad nightmare stories, but we won't get into that today.
yeah, yeah.
Um, so being a coach who focuses on specifically perimenopause and menopause, walk us through, how you help clients, what, you help them, like what the initial assessment kind of feels like, and then the journey, how long of a journey is it, etc.
Okay. All right. When a client decides to work with me, we typically start with labs. I use serum labs only. Not that I'm opposed to other things. We can do other testing. There's a lot of providers that are like, let's do this GI test and let's do the Dutch test and all of that. And those are great tests. They give you a lot of great information. But what I don't like about a lot of those functional tests is they're very expensive. And
Yeah.
so I think that basic blood work panel, there's so much that we can find out from a CBC, a CMP, looking at some inflammatory markers. We can do the lab set that I like to do is a really full and complete lab set. And this is serum hormone testing, which isn't always great, just depending on the age of the individual. If they're menopausal, it's okay-ish. But, for about $200, we can do a really full set of serum labs. For about $100, we can do a pretty nice set. So it's low cost. And
So can I pause for a second?
yeah.
Can you tell me, how do you get those labs ordered? Get the results, all that within, the scope of practice. So how does that all work?
That's a great question. I stay within my scope. So I have a couple of labs that I work with that I send a referral to. So their physician writes for the labs. I send over what we're requesting, and they have a physician on staff that writes for it. So they will, if there are any critical values, then the lab themselves will contact that patient directly. I put the order in for my clients. I don't pay for them. I send the billing to my clients, let them pay out. They pay out of pocket. They can pay with their HSA or FSA funds. So I'm not, so that's kind of the workaround. I'm not ordering them. And, there's a big difference between, so many people, they're like, my labs are normal. My doctor says my labs are normal. Well, your labs are normal means you're not in a disease state. It doesn't mean you're healthy. And so what I do is I'm looking for functional ranges. So I like there's so much that labs tell us. And I have a kind of a mindset of foundational work or foundational health. Let's work on the foundation. If we're building a house, we have to have a solid foundation before we put our roof on. We're not going to put up walls if we haven't built our foundation. And so there's so much with chronic inflammation most of us are dealing with, insulin resistance. Those are like the big things that I really target because that's at the root of all chronic disease. Gut dysbiosis, insulin resistance, chronic inflammation. And there are, and our lab work points us to all of those things. So until we repair the foundation, that is not the time to chase hormones. So hormones really are not, hormone chaos is not a hormone problem. It's a metabolic problem. We've got other problems at the foundation that need to be repaired. So if we're looking for a specific cure, hey, what do I do about this? What do I do about this? My approach is, well, let's look at your labs, and they're going to tell us, how well you're methylating, which means how well are you processing? Are you getting the nutrients that you're eating? Maybe you're eating all the right things, but maybe your body's not absorbing them. We're going to look at that. It's going to clue us into how are your mitochondria doing? So those are things that we want to look at first. What's happening on a cellular level? Like, are your cells inflamed? Can things even get in and out of there? What's your liver doing? Is your liver able to detox properly, or is it backed up? Are you constipated? Like, are you having a bowel movement every day? I would say most of my clients are chronic constipation. I had no idea the world was so constipated. I mean, it's a big deal. Like, that's the biggest way we get rid of toxins in our body. So if you're chronically constipated, girl, we got to fix that because
you need some fiber in this diet.
There's a lot that, we've got to start at the foundation, and those things are foundational. And so I feel like, not that I'm opposed to the functional labs. I think they're great. I love them. They're very interesting. But I feel like I would rather clients spend their money, if you're going to invest money,
Yeah.
let's buy you high quality food. Buy the organic pasture raised. Spend that money on organic
Yeah.
pasture raised meat
Yeah.
and some organic grains. Buy your organic oats if you're eating oats. Maybe not everybody's going to eat those, but put that money into high quality foods and maybe a
Yeah.
few key supplements that are going to give you the support that are going to fix the problem that we're going to spend on the $800 test. Like, why spend
Yeah.
$800 on the test if we know we have to fix these foundational things? And so I'm like, let's just fix it. Let's
I
just do
love
it.
that.
And
I
so
love
I
that
feel like
approach.
I just feel like there's some basic things that we know drive chronic inflammation. And chronic inflammation drives all autoimmune disease, thyroid
Yeah.
disease, heart disease. I mean, cancer. Cancer is a metabolic disease. The
Yeah.
conditions have to be right for cancer to grow. So all of those things, and when we target, again, this is not medical advice. Not
This
through
is for educational purposes only.
educational purposes only. But when we really get down, when we drive down that inflammation, and we get the blood sugar under control, we get insulin resistance under control, so much heals. So
Yeah.
much heals. And then we can
And
kind of
when
see what we're left with. And then let's go do the testing then. If we still have things that we're like, this is still a problem, then we can more clearly see what we need to do more testing on and where we need to investigate. So that's my philosophy.
No, I love it. And those tests can't, like, I have never done the Dutch test, but I know that a lot of people who have, and my eyes go very wide trying to wrap my head around spending that much money. But I think this is a good example of, I think one of the things that we're kind of up against is, there's a lot of criticism for the pharmaceutical companies making so much money. And then there's a lot of, swing the fence the other way, and it's like, well, supplemental companies are making a lot of money and not regulated. And it's like, well, why can't we start regulating the supplements, and why can't we start having the educated conversations that, I agree. Like, you don't need to walk into a supplemental store and go, because it can be overwhelming. You look at the shelf and you're just like, there's thousands of supplements here. You don't need all of those supplements. You might need one or two, but based off of, an educated professional who's looking at the whole picture, that's when you should be making those decisions, really, and not just be pouring a bunch of supplements into things. Because as you and I know, our bodies are basically chemistry, and when you mess with the equation or you overdo it, you can cause harm as well.
Mm-hmm.
Even with something as simple as a supplement, quote unquote.
Yeah.
So this is why someone like you is important, because you have the education to guide somebody in that right direction. When it could be so overwhelming to figure out where you even start.
Yeah, it is. And people are like, should I take this for this? Should I take this for this? Well, my question is, what's your blood sugar? How's your liver doing? Are you sleeping? Are you having bowel movements? Can you sit down and notice your breath for a minute? Like, that's a big thing. The whole we haven't even talked about nervous system dysregulation, which is, that's the beginning. That's the first step, right? So it can be overwhelming. That being said, I do love supplements. Like, supplements can be really life-changing,
right?
But I don't think you need to be on 20 different supplements. Like, that's just not, it's food first. You need to get it from your food first. Yeah. And then we need to recognize, well, our food is nutrient depleted. So I get that, our food is not what it used to be. But yeah, I don't believe in over supplementation. So if you're going to a functional provider and you're just leaving with a bag full of supplements, they're not understanding root cause medicine. They really aren't. Because we're talking, and it's very basic. It's what's your stress level like? Do you know how to regulate your nervous system? Are you sleeping? Tell me about your sleep. Tell me about your bedtime routine. Do you feel rested when you wake up? Are you getting restorative sleep? When you have a bowel movement, are you straining? Is it once a day, every other day? Tell me about your bowel movements. Are you eating Are you eating real food?
So
Things.
here's my question. Yeah, because as I'm having these conversations, and if somebody's listening to every one of them, they're probably going to eye roll right now because I have to say, and maybe because we've been trained, a lot of times we seek help because we want the quick fix, right? Or we want something that'll make it feel better now. And this root cause healing, or assisting our bodies into homeostasis, or however we need to word it, um, is not going to be quick. It's going to take time. It's going to take habit forming. And I do think that's part of the mind shift we all have to take responsibility for when we ask our physicians to help us, and our providers. So, like, if I'm coming to you, if I'm coming to a primary care physician or a specialist, we have to address the fact that we need to shift our mind, and we need to start verbalizing, I'm okay if we don't start with a medicine. I'm okay if we don't order me a prescription to start with. I'm okay if we need to have a different conversation. I think we've been so trained that that's the routine, that and then we're kind of disgruntled about it, right? Well, all they did was order a prescription. I think we need to start reframing how we approach the appointments. What do you think about that? Am I making sense?
Yes.
Okay.
This is why nurses make great functional medicine providers, because physicians are trained to make a diagnosis, and you're going to get a prescription. We can give you physical therapy, occupational therapy, or surgery. Pretty much, you know,
Yeah. Here's
or
the checkbox.
refer you to a therapist. Like that's
Yeah.
all we're going to offer you.
Yeah.
And so the system doesn't allow, the current system and insurance requirements and Medicare regulations and all of that doesn't really allow for a practitioner, medical provider, somebody that's writing for prescriptions, to really sit down with their clients and get a whole history and get the whole story, because you really need the whole story. So
Yeah.
as nurses, we're trained to look at the whole person.
Right.
And so that's why, and in functional medicine, you look at the whole person, the whole story. So really, I feel like the whole nursing process, that assessment, we assess, we diagnose, we make a plan, we implement it, we evaluate, we do that process. That's very much follows the same pattern that functional medicine teaches. Is we're gonna assess the whole person.
Yeah.
We're gonna make in nursing care plans, we
Care
all
plan.
care plan. So essentially, I'm writing a care plan. Readiness for enhanced learning, hyper. There's a whole list. Of course, I'm drawing
Chronic pain.
yeah. So there's, so
Yeah.
I can take a nursing diagnosis, and then that
Yeah.
way I know I'm staying in my scope. So I can apply a nursing diagnosis, and then we're going to talk about, okay, what are the interventions we're going to do? I'm not prescribing, I'm not diagnosing a disease, but I'm going to come up with some nursing interventions that put that person into a state of healing. I'm thinking of I wish I had it on my desk here. There's a Florence Nightingale quote where she talks about medicine is like the person comes into the healthcare system, and I'm botching this big time, but we remove the bullet. That's the medicine. But our job as nurses is to put that patient in a place where nature can heal, where nature is the healing force. And that is true. Our bodies know how to heal. Our bodies have this infinite wisdom. They know what they need. They know how to heal. But we have to allow for that healing, and we have to remove the barriers to healing. So, and then that goes along with healing doesn't always necessarily equate to cure, right? It's not always necessarily that I'm cured. Maybe healing is I have greater peace, or I can live with this chronic thing, or acceptance, or whatever. Sometimes it is physical healing, but sometimes it is a cure, but it's not. Healing doesn't always equate to a cure. But yeah, people just
Yes.
have to be in that state where nature can do its work.
Yeah. I love it. I agree. In the cranial sacral world, we call that inner wisdom or inner physician. And in a lot of these alternative modalities, we do talk about that innate ability that our body has to heal and, find its homeostasis again. And we just have to give it the tools and support it, be a facilitator. So I love being a facilitator to that process.
Right.
So,
Yeah, and
well,
that's how I look at it too. And I think of all these modalities as I like the analogy of a tool belt. I think, okay, I've got this tool
mm-hmm.
and that tool. I'm not necessarily going to use all the tools, but I want them all in there.
Yeah.
I'm not a big, I don't like over antibiotic use. I had a lot of problems with that as a kid, but also, in a life-threatening situation,
Isn't it a
antibiotics
great thing?
antibiotics could be the miracle. So it's being doing things judiciously
Yes.
and really listening to people what they want where they are. And I think that we don't do that. We roll our eyes and we say, oh, they're non-compliant. If there's any pushback with, when we're in the medical community, if we're like, okay, you're going to do this and this, and they're like, but that doesn't work for me, or I'm not, we just dismiss people.
Yeah.
And
Some of
just
my greatest rewards in nursing have been in those situations where there's that pushback, and I've had to execute the skills over the years where I've learned to get curious instead of lean into judgment or I know what's best or, whatever. And just say, okay, like, if you don't want to do that, that's your prerogative. Like, how can I offer something right now, right here, right now to support you? And in my world, that's a hands-on modality. Um, that in that world, for me, has brought more reward client to clinician
Mhm.
than just regular like task-oriented bedside nursing.
Yeah.
So that it resonates with me for that reason, because it goes back to I want to hold your hand, look you in the eye, and support you in whatever you're going through. I can hold space for that.
Yeah, that makes a lot
So
of sense. And I
yeah.
think healing touch is a very similar experience in that you're,
Mm-hmm.
as a
Oh yeah.
practitioner, you are healed. That client might receive some sort of healing, but as a practitioner, you are also healed in
Oh
that
yeah.
process and being
Yeah.
able to have that connection.
Yeah.
And then I think that's where the coaching skills are important too. With, if clients have concerns or something, it's like, okay, well, tell me more about that. Tell me, what does that mean? What
Yes.
does this mean? What does that look like for you?
Or
And
if
so,
you see someone start to panic about you're offering a medication or a pill or a change in diet,
yeah,
and you see them start to clam up, give some space for them to express why there's some
yeah,
resistance. Yeah.
yeah,
It goes a long way.
yeah,
Well, I love talking to you. You are, you know, I feel very kindred spirit, in the sense that continual learner, want to keep learning and growing, just want to do some good in the world and
yeah.
do it in a way that works for us and the client. And I would love to share with how people can get a hold of you or coach with you. And then also maybe do you have does the website show packages, and how do you do per session?
What I typically do, I have on my website, I have a link for a consult. So if you are interested in working with me, I do a consult. So
Okay.
what I offer now is I offer an upfront package where we'll do the labs and I do like a complete functional lab analysis. And that's like a 2-session package.
Okay.
Most people continue to work with me after that. And then I just charge a small monthly fee month to month after those 2 sessions. On that, it would start like on that third session. Most people really need 6 months minimum to work with me, or more, a year, two
Yeah.
years. I mean, healing, like you said earlier, it's not a quick fix. People do, if you If you want a quick fix, I'm not your girl. You're ready to make some changes, ready to commit to small, consistent changes are,
Yeah.
what changes things over time. There are no quick fixes when you're trying to heal, and it's a journey. It's not cut and dry. It kind of goes like this. Healing is it's kind of a DIY job, I've learned.
Yeah.
I don't, I can guide people, but I don't necessarily know what they need. I can help them with some aspects, but healing is definitely a journey. And yeah, it's not linear. You know that.
It's not
So
linear.
just go to my website. It's
Okay.
jandersonwellness.com.
Okay.
And yeah, there's a link there. On my contact information is there. That's probably the best way to contact me.
Okay.
And yeah, so
We'll include that in the show notes as well,
okay.
so that you have so people can access it there. So just remember to follow us at Holistic Nurse Academy on Instagram, Facebook, YouTube, all those, and then we can include it in the links. And also, we're on Apple Podcasts now. It took us a minute to get on there. But thanks again, Jennifer, for coming on and sharing your wisdom and hard-fought wisdom. That's what I call my wisdom is hard-won, hard-fought wisdom.
We earned it. Right?
So, yes, we earned it. And if you haven't already and you're listening, please like and subscribe. If there's a particular episode that you're loving, including this one, please share it with your like-minded nurse friends so that we can build community and have a safe place for everyone to come and share what we're sharing in this particular space. And we will see you next time. Thanks again.
Thank you so much, Holly. I'm so glad that you're having these conversations. I think it's so important and so valuable. Thank you.
Thank you. Appreciate it. Have a great day, everyone.